Good morning, everyone. My name is Brianna Young. I'm an undergraduate research assistant with the Virtual Reality Laboratory. I did my project on healthcare data visualization of COVID-19 data. Some of my goals were to visualize COVID-19 data and its relationships with different strains, death rates, and different states. I was to also find common links between COVID-19 data, hospital beds, different states, and unemployment. I was to also visualize this data through bar charts, line graphs using Power BI. Some of the keywords I used throughout my project were pandemic, coronavirus, variants, COVID-19, and ICU. The coronavirus pandemic first became prominent in China 2019. The virus quickly spread and impacted many countries around the world. By March 2020, the United States went on its first lockdown. The symptoms of COVID-19 can range from very mild or asymptomatic to severe and requiring medical intervention. The United States has experienced almost 35 million cases of COVID-19 and over 600,000 deaths. COVID cases in the world are nearing 200 million. Elderly individuals, pregnant people, and those who are immunocompromised or have underlying conditions are all at greater risk for contracting COVID-19 and having a severe case. Severe cases may require hospitalization, a ventilator where the patient is having trouble breathing, ICU treatment, and can result in the death of the patient. This line graph shows the relationship between COVID cases and deaths per state. The graph was formatted to present the highest value data on the left, descending until the lowest value data on the right. So the states are on the x-axis are not in alphabetical order. The graph shows that there is a big difference between COVID cases being the light blue area and COVID deaths being the dark blue area. This being that deaths per state were significantly lower than cases per state. A few factors play into why the values for cases and deaths differ. One factor has to do with the availability of COVID-19 testing. In March 2020, tests were scarce and had to be prioritized. Once tests were widely available, more cases were discovered, which helped identify mild and asymptomatic cases and finding severe cases earlier. This is part of a time series that displays the new COVID cases and deaths reported daily from January 2020 to June 2021. It shows the first increases in new cases for COVID-19 data, which occurred around March 2020, which is right around the time lockdown began. The growth in data is the result of the new cases of COVID-19 we began to experience in the US daily. We can see a peak in data around December 2020, which was likely due to a combination of any of the following, being pandemic fatigue, flu season, and colder weather. Pandemic fatigue is a feeling of overwhelmingness and can result in individuals not being as careful and less compliant with CDC guidelines for mask wearing and social distancing. The colder weather also increased the likelihood of gathering indoors. Indoor gatherings are higher risk because the virus spreads easier when particles have less room to disperse, like they could outside. Another factor is flu season. Flu season begins around October, and it is possible to have both the flu and COVID-19 at the same time. Having one virus can make a person more susceptible to getting the other. This will be a screen recording of the same graph inside Power BI, so you can get the full effect of the time lapse. So we began in January 2020, heading into March 2020. We're reaching the summer in June. We've gotten to October, November, and then the peak is around December 2020. And after that, we begin to drop down. And then the data ends in the end of May 2021. So this is a visualization of variants of COVID-19 found in the US. New variants are created when a virus changes by mutation. Variants often have different characteristics and effects. These can include, but are not limited to, vaccine effectiveness, treatment methods used, symptoms, and the ease of transmission. There are three variants included in this graph. They are the P1, which was first found in Brazil and also known as the Gamma variant, B117, which was first found in the UK and known as the Alpha variant, B1351, which was first found in South Africa and known as the Beta variant. The reported cases in the US of each variant are as follows: 20,915 cases of the UK variant, 490 cases of the Brazil variant, and 453 cases of the South Africa variant. It is also important to note that each state didn't report cases. The Alpha, Beta, Gamma, and Delta variants are all variants of concern according to the CDC. The Delta variant is the most recently detected variant, first being found in the US in March 2021. This line graph shows ICU occupancy, or total patients in the ICU on a given day between July 2020 and July 2021. As shown in previous visualizations, we can see a spike around December 2020. Frontline healthcare providers were hit hard during COVID-19. A high ICU occupancy doesn't just mean limited beds, it also means limited experienced care personnel and equipment as well. Adding to the surge in cases shown in previous graphs during the same time period, there were consequently a surge in hospital stays. The reality is that hospitals do not only hold COVID-19 patients, but they still have to care for people with other ailments and conditions such as cancer, heart attacks, and any other emergencies, and this also contributed to the lack of space. This bar chart shown represents unemployed individuals by reason for unemployment, sex, and age. The leading reason for unemployment in 2020 was due to job loss and completion of temporary jobs. The reason following and second was temporary layoff. This data features the age group of 16 and older, 16 through 19, and 20 and older. With the United States going on lockdown in late March of 2020, we experienced a record number of unemployment with over 20 million jobs lost 1 month into lockdown. April 2020 was the peak of unemployment and it fell in the following months. An interesting observation is that younger people were affected the most by the coronavirus-induced unemployment spike. By 65%, unemployments who lost their jobs were between the ages of 16 and 24. This is a representation of unemployed job seekers by sex, age, and the job search methods that they used. The number one method used in each age group was to send out resumes or fill out job applications, and this was followed by contacting employers directly. Most job seekers were between the ages of 16 and 24, and this would connect directly with the realization that this was the age group who experienced 65% of the job loss. In conclusion, I was able to visualize COVID data for ICU occupancy, the variants active in the US, and COVID's impact on unemployment. I was also able to visualize relationships between COVID and hospital beds, the different strains, and states. COVID has impacted our job market, healthcare system, and our frontline workers greatly. I want to send a special thanks to the Virtual Reality Laboratory and to Dr. Sharma for his guidance and for the opportunity to conduct this research. I would also like to acknowledge the following grants on the screen. These were my references, and I would like to thank you all for your time.